Hi everybody, my name is Christina Mosher and today I will be talking to you about social stories. My group members Amber Nelms and Olga Renesades also helped me put together this presentation today. So, what are social stories? Well, social stories were developed and created by Carol Gray in the 1990s. They were made to assist individuals with autism spectrum disorders to deal with social situations. They were designed to help describe the situation, the skill, or behavior in terms of social cues, perspectives, and responses that are appropriate and acceptable within a specific context. They do foster meaningful ways for individuals with ASD to experience different ways of coping and to interacting with others. One of the things that they're really known for is teaching individuals with autism spectrum disorders how to handle certain situations and act appropriately. So there's several different types of sentences used in a social story. One of them is called a descriptive sentence. What that does is it explains the questions like who will be there, why, where, and how the situation will occur. So an example of this one would be, at school, most people go to the cafeteria for lunch. The next one would be a perspective sentence. So that one enlightens the potential thinking of all individuals involved. And it's also very pertinent to the setting. So an example of this one would be, many students like to eat their lunch with others. Then a directive sentence. So it is a directive sentence pinpoints the correct behaviors for the child in that particular setting, and it also tells them what to do with their behaviors and what appropriate behaviors to use in that particular situation. So an example of this would be, when I eat, I will touch my food. A control device sentence basically tells what the cues are that the child should look for when they're in a certain setting. The affirmative emphasizes sentences basically emphasize the important rules that need to be remembered. The cooperative sentences are basically formulated so that the child can know how others can assist them in the recognized setting. And then sometimes there are partial fill-in-the-blank sentences. What those do is that they encourage not just facing a certain situation and kind of test the individual what they should be doing. They're really good for practicing in social stories, which is something that we can be doing while implementing our social stories always. So some research background about social stories. Carol Gray, who you may remember invented social stories, along with Joy Nichols, published their first study on social stories in 1993. That was a study that was focused on autistic behavior with social stories. Overall, there are actually limited studies on individual social stories in practice. However, it is still an evidence-based practice. And one of the reasons for this is because usually social stories are used in combination with another type of intervention. So they're never really just used alone. And during the studies, it's hard to tell which one helped the target behavior be accomplished or decreased. Was it this other intervention or was it the social story? It's hard to tell when both are being used. However, in a very recent study done in 2015 by Payne and colleagues, determined that the function-based social stories in combination with function communication training did bring forth a considerable decrease in the targeted behavior. So who are social stories appropriate for? Well, as we said before, they are widely used for individuals with autism. That's pretty much who they were invented for, though I'm sure they could be used for other individuals. They're also usually used with individuals who have verbal skills. So individuals, who are also aged between 4 years old into adulthood too. And that's because we want them to make sure that they're understanding the story, that they're able to practice it, and we can talk to them about about what they need to do next too. There are also many educators that use it for problem behaviors. So they are pretty commonly used. So how to write a social story. are the following. You want to make sure that you're describing the setting in simple terms. You want to make sure that the story describes more than it directs or basically tells the individual what to do. You want to make sure that you're writing your story in either first or third person's perspective. You also want to make sure that you're using Gray's descriptive framework for creating the story. So she did specify a specific ratio to use for the sentences. She said that the ratio is between 2 to 5 descriptive sentences for every directive sentence. So you want to make sure you're doing more describing than telling them what to do in your social story. And then you also want to make sure that you name the people, give the order of events, and let the individual know why things are occurring in the setting and what the appropriate response would be. So this video, real quick, is a video of Carol Gray, just kind of describing social stories. As we said before, she is the one who invented social stories.
Social stories are an evidence-based strategy used with individuals with autism spectrum disorders. Parents and professionals develop the stories to address a wide variety of topics. There's a lot of confusion about what is and what is not a social story. Here we address the misconceptions by looking at the current definition of social stories and one of the most frequent mistakes made in developing them. The short definition of a social story states that a social story accurately describes a situation, skill, or concept according to 10 defining criteria. These criteria define the characteristics of every social story, as well as the process that is used to research, write, and implement it. The complete definition provides additional detail, stating that the criteria guide story development to ensure a patient and supportive quality, and a format, story voice, and relevant content that is descriptive, meaningful, and physically, socially, and emotionally safe for the intended audience.
So that was Carol Gray talking about social stories. This next one here is just an example of the FACE-A program that we will be implementing with our social stories. Basically what FACE-A is a computer program that the children will go to after reading their social stories to help them learn social skills, eye gaze, things like that. And they will be playing games in order to learn those things. So this is an example of a game.
This student looks wrong. Can you please click on the one I'm looking at? Thank you. That's just what I wanted.
So how do we implement social stories? Well, the best use after an functional behavior analysis has been conducted, or a functional analysis, so that we know that the function of the behavior exists. And we want to know what the function of the behavior is so that we can write our social story about that or pertaining to that function of the behavior. Studies have been proven and shown that social stories are more effective when they're written based off the function of the behavior. You also want to make sure that your social story is written individually for each child based on their problem behavior and, as we said before, the functions of their behavior. So in our program, the students will read their social story at their desks. They will answer questions when they're asked, like fill in the blank or verbally. And then those social stories will be in their binders to read at their desk. After they read them, they will go over to the computer and they will play with the FACE-A program to practice their social skills. So there are many different ways you can write a social story. You can make a video. You can do it the way that we're going to do it. But if you do decide to make a video, this right here is a very good example of a very short one. However, the one thing I will say right away before I show it that I'm not exactly fond of is that it only uses directive sentences, I've noticed. You want to make sure that you are using descriptive, perspective, and direct sentences within your social story.
Angry is okay when things go wrong, but we have to stay safe, follow the rules to make things better. So this is how we're going to do it. First, take 3 slow breaths. Good job, Lynn. Next, open your hands. Now you've earned your second star. Now keep your hands safe on the table or at your legs.
Okay.
Thank you for keeping your hands safe. You did such a great job. You earned another star. Now there's only one more thing we need to do. Now you can say this out loud or show me that pet card. I am calm and I need help.
I am calm and I need help.
And then this right here, going to the dentist, is a social story that I wrote for this presentation. So this one is an example of a child who is probably afraid to go see the dentist for certain reasons. So I'll read it to you. Going to the dentist. Everyone needs to see a dentist. The dentist makes your teeth shiny and white, and the dentist also helps prevent toothaches. My mom and dad will help take me to the dentist every 6 months. When I go, I will first check in at the front desk. Then I will sit in the waiting room before the dentist is ready for me. I can play on the phone, I can read books, or watch TV while I am waiting. I cannot run around the waiting room. This will make my mom or dad upset, and I could hurt myself. When the dentist is ready for me, I will hear my name being called. I will follow the dentist to the room. When I get there, I will sit in the dentist chair. When I sit in the dentist chair, the dentist will ask me to open my mouth wide so that they can look at my teeth. It's okay to be scared when this happens. If I am scared, I can say, I am scared, or please give me a moment. And the dentist will gently look inside my mouth and clean my teeth when I'm ready. This doesn't hurt. After I let the dentist clean my mouth and check inside, I will get a prize from their toy box. Going to the dentist is no big deal. I can do it. So, how do we determine if social stories are successful? Well, first of all, like I said before, we want to make sure that we're making our social stories based on the function of their behavior, as that has been found to make social stories more effective. You also can test if the student's understanding the social story by asking them questions, to having them do fill in the blanks. And when they answer correctly, then you know that they're at least understanding the information that's in the social story. Overall, you'll know that it's successful if the student reduces their problem behavior. So quick overview, utilizing the social skills strategy with the FACE-SAY program will help students to learn to engage in contingent responses to an interaction or conversation, appropriate social engagement with adults or peers, attempts or bids for attention, making comments about a given situation or making requests. And then they will also use the FACE-SAY program to help identify different facial expressions and emotions that are connected to social engagement. So some quick final tips. You need to remember that there are several different types of sentences used in social stories. They are descriptive, perspective, directive, controlled advised, affirmative emphasizes, cooperative describes, and partial fill-in-the-blank types. Always want to make sure that you're writing a social story based on the function behavior if possible. And then always make sure that you're keeping the story personable to the student and individualized for the student. Most social stories won't be exactly the same from student to student. There will be some differences because it's based on the student themselves. So I want to thank you for listening to our presentation today. This slide right here is all of our resources used to present this wonderful presentation on social stories. If you have any questions, please feel free to contact us and we'll be happy to help.